Gracia? Opo, duguan po siya at wala ng malay. Opo, pumunta na po kayo dito. O sige po. Thank you po.
Prepare the defibrillator, starting at 150 joules.
Chance 150 joules. I stand clear, everyone clear. Start shock. Shock given. Start CPR.
Administer epinephrine 1 mg.
Administering norepinephrine.
Prepare the patient for intubation and prepare the suction apparatus. The machine itself, the collection container, leads to the canister, connection tubing, and Yankauer suction tip. Before using the laryngoscope, we need also to check if there is a light. Select appropriate endotracheal tube size as ordered and inflate the endotracheal tube cuff and check if there is any leakage and deflate the cuff completely. Before using, we need to lubricate the endotracheal tube and the introducer, and then insert the lubricated ETT introducer to the endotracheal tube. Bend the endotracheal tube gently into a crescent shape, and then, after that, the physician will insert the laryngoscope to initiate the intubation. And then, the physician will inflate the endotracheal tube cuff once the endotracheal tube is in place. Confirm the endotracheal tube lip marking before securing with adhesive tape. Once the tube placement is confirmed, it must be secured with adhesive tape. Then, ventilate the patient every 6 seconds and document the procedure.
The patient transferred to ICU.
Early CT scanning rather than admission and observation for neurological deterioration will reduce the time taken for life-threatening complications. Ongoing assessment of the GCS, early CT scanning, and early involvement of the neurosurgeon should be key components of the patient's care.
For the necessary stat intervention for the patient, first you have to monitor the vital signs of the patient, and then you have to insert a venous access to replace the fluid or the blood loss. You have to give a supplemental oxygen to the patient, ventilate the patient, and administer the medication as ordered by the physician.
Documentation. Patient was brought to the ER and found to be unresponsive due to vehicular accident at 9 p.m. On examination, absence of carotid pulsation and respiration. Code blue activated with initiation of CPR and bag valve mask for ventilation. Code blue team arrived at 9:10 p.m. CPR continued throughout resuscitation. The patient attached in a defibrillation machine, starting shock at 150 joules delivered by the doctor. Drugs delivered in resuscitation via IV, 1 mg epinephrine given every 3 to 5 minutes. IV fluids infused. Patient intubated by the doctor. Endotracheal tube was inserted. Patient returned of spontaneous circulation at 9:30 p.m. Vital signs were taken and GCS were assessed. Patient admitted to the ICU at 10 o'clock p.m. Organization of resuscitation. Teamwork leads to more effective communication. Coordination is key. Everyone has their own contribution to make depending on their skills, abilities, and talents. Get to know who does what role and also be aware of your own role within your team. This allows for tasks to be divided easily and quickly, and ultimately for everyone to reach the same common goal. Look after everyone in your team. Flexibility and adaptability to help others in time of need are important in ensuring patient safety and also the well-being of your colleagues.